Hello, this is Dr. Katie from Craig Chiropractic and Kinesiology, and today we are going to talk about neck pain. Now, this is very common, unfortunately. Many people in the United States and around the world, for that matter, all deal with neck pain. So we're going to just cover a few things in this video. We're going to talk about some basic things that cause neck pain, some potential treatment options that I give and advise as a chiropractor, and a little bit about my history directly with neck pain. So let's start with it. What causes neck pain? Now, the most obvious would be some type of traumatic injury. So think like a car crash. Traditionally, we think of whiplash injuries. So if a car is rear-ended, right, one is driving one way or perhaps stopped, another one comes up behind and hits, forcing that motion forward or in this direction, that can cause a whiplash injury. So what happens here is your person's sitting relatively still, and then there's this violent impulse from behind, forcing the head forward, and then it usually bounces back. So as you can see, it's this whipping motion, just like a whip. That can cause a stretch or strain of the muscles and ligaments in the neck, okay? So, I mean, in very, very severe critical cases, there can be actual tearing, okay, and permanent neck damage. In more minor cases, it's more of a minor pull or strain, okay? Things that can also happen is vertebrae in the neck. So we see all the individual bones, individual vertebrae, they can shift or be pulled out of place. Okay, sometimes with the whiplash injury, it's not always, perfectly head on. Sometimes you get knocked to a side or there's a twisting motion as well. So these are all factors to keep in mind. So common things that can cause the neck pain is number one, vertebrae being shifted out of place, whether by a major accident, think car crash, sports injury, you take a hit directly to the neck. Think about a hockey player. I've seen hockey players before where they've taken a stick to the neck. Not great. Okay, we have those. Other things that can cause pain is pulled muscles, pulled ligaments. Okay, then we see the yellow parts here. These are all nerves. They would be going longer out to the body. And sometimes those can get pinched here, can cause pain. Now, those are the most obvious cases of injury, right? There are also not as maybe noticeable causes. So I like to call these the micro traumas, right? So they're small. So think like every day, if I'm gonna go sit at my desk, right? I'm here, maybe I'm typing on a computer. A lot of average Americans, we don't just sit nice and tall. What do we do over the day? We tend to, see what I'm doing? Slouch forward. See how far forward my head is. Your head is very, very heavy relative to the neck here. So when I come forward, that puts a lot of strain on that neck, okay? We call it text neck. Sounds familiar? Got your phone, we're looking down. So that constant strain and pulling, this can lead you more susceptible to neck pain, future neck injuries, and headaches. None of these are good things. They're all very preventable, and they're all things we can work with, so that is good news. So in a nutshell, those are some common things that can cause neck pain. Now, what are classical treatment options? There are many different options. Traditionally, as chiropractors, we are, of course, interested in making sure the vertebrae are lined up where they should be. We're also interested in helping get rid of that nerve interference, keeping everything clear. So we work to adjust everything back in place. All right, and how do we do that? Many chiropractors traditionally adjust by hand. You've probably all seen the adjustments, either videos or had it done, where a chiropractor comes and by hand, they do a pulse and bring it back, okay, in a very safe manner, all right? A lot of good research behind this. Neck adjustments are safe and effective when done properly by a trained doctor of chiropractic, okay? It's not the same thing when you're doing it at home. That's different. Okay, so there's the manual adjustments. There's also instrument-assisted adjustments, like this. This is called an activator. Now, I have used this one or showed this one in one of my other videos where I went over chiropractic tools. So if you're interested, feel free to head over to my channel and look up chiropractic tools. I explain what this one is. This tool does adjust. There is good research on it. And so it's a very gentle way here where if I find a vertebrae that's out of place, I can actually take this click and I can impulse and help adjust it back in. This is very safe, very effective, and it's another alternative to the manual adjustments. So just a little backstory here on myself, just quick story time. I don't know about you, but I like stories. So I got partially interested in chiropractic for many reasons, but mostly because of my own injuries. Once in college, I was rear-ended, okay? Remember that injury we talked about earlier where you get that whiplash or the head comes forward? I got that, and I developed chronic neck pain and headaches, okay? You can get the headaches, and they were pretty severe. Now, before this point, as a kid and through high school, I had seen chiropractors. I had been manually adjusted where we safely adjust the neck. It had always worked great for me. Once I had that whiplash injury, that severe injury where my head went whipping forward, the ligaments were so just stretched out and injured in my neck that they weren't as stable previously, okay? So in my case, I didn't do well with manual adjusting after that. Now, it didn't mean that the manual adjusting was harming me or I was in danger. It just meant that it was uncomfortable, and if I had a manual adjustment done, I could get like a little dizzy or have a mild headache, which wasn't very pleasant. So I worked with my different chiropractors at the time, and we discovered that instrument adjusting or activator adjusting was actually a lot safer and more comfortable for my neck with the injury level. Now, I've seen many different well-qualified chiropractors, all different techniques, and I've got to say this has been one of my favorites. It helped me while I was rehabbing my neck, and yeah, it's been wonderful. It got me interested in instruments, learned how to do that. In fact, that is actually how I adjust necks. As a chiropractor, I personally don't do manual adjustments. I still believe in them. I think they can be great. I also recognize that they're not appropriate for all patients, and some patients prefer instrument adjusting. This is what I specialize in. This is what I do. I get a lot of success with it. You know, it's awesome if you don't like the cracking or popping sounds, if you want to have more of a gentle adjustment, or that say you have a previous injury and your neck's very tight. This is a great option and alternative. And if you're curious about that, you know, feel free to make an appointment. We can talk about that and we can go through that more with you. All right, well, thank you for listening today and look forward to seeing you next time.